Welcome to our series of healthcare scene interviews where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of healthcarescene.com, a network of leading healthcare IT resources, and I'm happy to host this panel of experts in precision medicine. Before we begin with our conversation and interview, I want to remind those watching live that we'll talk for about 30 to 40 minutes and then we'll open it up for questions from the audience. So those watching in our live audience, feel free to stick around and you can hop on camera, share your insights, ask questions. Also, if you want to and you don't want to hop on camera, you can do /Q space and then add your own question and that will submit it to the queue. If we have time, we'll try to incorporate it into our conversation. If not, we'll do it in the after party, the 30-minute after party. Also, if you're watching live, if you like what someone's saying or you like that person, you can click on their face, give them props. Also, if you do on the left side, you can tweet to your followers and tell them about this conversation and invite them to participate as well. Super easy to do. Just use the tweet button and the Facebook button on the left side. All right, enough with the logistics of it. Let's get started with some short intros from our esteemed panelists. Let's start first with Curtis Dudley, Vice President of Performance Solutions at Mercy. Welcome, Curtis.
Good afternoon, everyone. And as you said, my name is Curtis Dudley, and I'm the Vice President of Performance Solutions here at Mercy Health, based out of St. Louis, Missouri. And we're an organization, we're the sixth largest Catholic healthcare organization in the country. We're about 30 hospitals, about 400 clinics. And I lead three buckets for Mercy. I lead a data science group, I lead our data engineering and analytics, and I lead a technology performance improvement. But glad to spend time with you all today.
Excellent. Good to have you here as well. Next up, we have David Delaney MD. He's the Chief Medical Officer of SAP Public Services and Healthcare Industries. Welcome, Dr. Delaney.
Thanks, John, and good afternoon or good morning, depending on where you are, to everyone out there. It's a pleasure to be with you today. In terms of my involvement at SAP, I serve as Chief Medical Officer of the healthcare sector and really engage closely with customers and valued clients such as Curtis and Mercy, really to help them innovate, to understand, where their challenges are from a strategic perspective and help leverage SAP technology to help solve them. So a large part of my time is spent on the road, meeting with organizations and really helping them provide value for their end users, both the providers and patients.
Excellent. Well, I'm interested to hear Mercy's story, but also to hear kind of the broader perspective. Since you travel the world, SAP is certainly a global company like none other. So I think you'll offer some interesting perspectives. Let's start by, let's hear a bit about Mercy's story. So Curtis, let's start with you. Tell us about your work with perioperative services and the work you're doing at Mercy. And really, maybe let's start with what was the challenge you were trying to solve?
Great. So I think everyone's aware that the enormous pressure on healthcare and there's a lot of focus by healthcare providers to reduce costs and improve quality. I think everyone recognizes that everyone is highly focused on that. And for any organization, perioperative services is a huge percentage of the overall cost picture. So what we were trying to do in Periop was to reduce our cost, and also improve quality because there are financial incentives for quality improvement as well. So when we first started looking at what was going on within Periop and what they had to go through to get to information, we were pretty amazed that everyone had to go to a every different siloed system. So you'd go into Epic to pull up a EHR report. You'd go into Lawson, which is our ERP, to pull up a different report. And you go into Omnicell, and there's a variety of different systems, which I think is what a lot of healthcare providers struggle with, is just connecting all these different pieces of data together. So folks were manually compiling this information from each one of these different systems in a spreadsheet. And the time that it took was just an exorbitant amount of time to compile all this information together. So what we wanted to do is we wanted to provide a means where clinicians and leaders within perioperative services could get to that information in a seamless and in a more real-time fashion. So what we did is we created using our SAP Business Objects platform setting on top of HANA, we created a series of dashboards that have provided an interactive way to get to block utilization, cost per case, and patient logistics data in a way that we've never been able to do. And the results are pretty staggering in that last year we saved $13 million in bottom line cost. We reduced our total knee cost by 1.2 million, and we improved our block utilization time by 12%. So just providing transparency and visibility within the data within perioperative services has had a profound impact and continues to have a profound impact on our ability to manage cost within that service line.
So, I mean, it seems like it's the age-old issue of moving from a stack of spreadsheets, right, a stack of Excel files into a more modern world. Is that a fair description of what happened?
Yeah, unifying, we call it unification of the data and bringing it together in a BI platform on top of HANA. It is really setting that data and organized and managed in a way that we can put our delivery tools on top of it and present high-level metrics. So you can go in and you can see, what the average supply cost per case is for a total knee, and then you can drill down to by doctor and by supply category and down to the item level. And our approach, what's really driven the benefit is really benchmarking each provider against each other to show everyone's average cost per case, and then being able to drive into the details and say, the reason why your average cost per case is higher than the next surgeon is because you're using this particular type of mixing bowl, or you're using 2 bags of bone cement, or you're using the most expensive total joint implant, and really highlighting to doctors what those variation or what those differences are, and letting them make the decision on whether or not they want to use the lower cost and of equal quality. And I think that's the other component when we talk about bringing all these different data sets together. We were also able to bring quality and safety data together to look at readmission rates and post-op infections and things like that. So it wasn't just about lowering the cost. It was also about making sure that we were delivering on high quality at the same time. When the physicians could see that they have another doctor who has a lower cost and their quality is the same or better than theirs, it's a compelling argument to get them to convert from one particular product to another. So it's provided a great visibility and enabled us to achieve some great results.
That's great. I love how you're approaching it by empowering the doctors, not, hey, we're watching what you're doing. Instead, it's here's the information, you make the decision, which I think is the right approach with doctors. And, good luck doing that in Excel, right? Like, just make
we found out the predominant delivery mechanism at the time was spreadsheets, and that was due to a lot of manual aggregation of data and calculations. Now we have it in a unified data platform for all this data certified and managed. Everyone's pulling from the same source. They're getting the same answers. We're not spending time trying to figure out why one person who created a spreadsheet had a different answer than somebody else who created it. It all pulls from the same place, and that just streamlines our ability to get to the answers that we need, rather than spending our time just debating who's right. And I think that's a big point as well.
Such a massive point. I mean, I've heard so much about how much productivity is lost just debating on which is the right data. I mean, just whole meetings dedicated to arguing about whose data is right, as opposed to having the right data and making good decisions. That's great. Well, let's add in Dr. Delaney. I'm sure this is a problem other places as well. I mean, do you want to expand on the scope of what they've done? I mean, and maybe some of the other benefits you think Curtis may have missed as well.
Yeah, we love working with Mercy. They're very progressive. Thoughtful and really embrace technology as a change agent. And, speaking on behalf of doctors, when you take a step back and looking, at what's the challenges are that face us, the way we train is very much an apprenticeship style fashion. We learn from those ahead of us, both the good and the bad that they have. And they spent their careers paying attention to cases and seeing what seemed to work and what didn't seem to work, and they pass it on. But, absent feedback, our tendency is to continue with what we're doing, right? And we don't have time often to go and pull individual cases and try to understand how we're performing in a more nuanced fashion. If it's something we don't see as much of, it's even harder because we don't really have, as I like to say, the plural of anecdotes doesn't equal good data, right? Yet that's all we've had in the past is our own ability to sample, to recall, and to identify patterns. And as humans, we're good if we see a lot of it and it's a single factor, maybe identifying over time. But if it's something we see less often, or it's more nuanced, or maybe it's multivariate, we're very poor at picking that up. So as Curtis said, the ability to effectively turn the lights on and to show us how we're performing, how other people are doing it, and to really look at the ability to achieve better outcomes and even at a cheaper cost. That's the tremendously exciting thing right now in healthcare is that, the downside, of course, if you look at a value graph, you plot cost versus quality, you'll see a scatter plot where there's no correlation between cost and quality pretty much anywhere on anything, right? But what that offers is the opportunity to begin to understand where variance is occurring, why it's occurring, and how you can begin to standardize, and then do something very magical, and that's simultaneously improve quality while reducing cost. Right, and that's what happens in the maturations of industries, and this is the journey that I think Mercy is helping lead the way on. Is really providing the feedback to the doctors, so they no longer have to rely on gut and intuition, but can look at hard data and can learn from that data and hone their practice in a much more nuanced fashion than they were able to in the past. So I think it's just an incredibly exciting time, and Periop is a tremendous place to begin because for many and most hospitals, it is a real revenue center. I mean, there's margin there, there are higher cost cases, and you can figure out how to get a higher turnover in the same number of OR beds. You can drive improved revenue, and if you can figure out how to reduce costs at the same time, as Curtis and team have done, it's even better. But it's a great place to start. But really look at it. I mean, the mechanics of what he described are a microcosm of the challenges that face all organizations, and that's pulling in data that lives in disparate places in an organization, has varying levels of quality, establishing some kind of master data management, so you have data which is trusted and believed, and exposing that back to end users who, for the most part, are hungry for the ability to improve themselves. And oftentimes you just have to show them, and you'll get the kind of a virtuous cycle created of improvement, which is very exciting.
Yeah. I'm reminded of a CMIO from Intermountain. He said at one point, he said the human mind is unable to see a difference in 1% improvement. And so we need the data to inform us, to help us understand that, the difference between 2 in 100 and 3 in 100, well, that could be one life, right? Which really matters in a lot of ways for lots of reasons, right? But, we as humans anecdotally can't process that difference. So it's good to put it in data. Interesting. Well, Curtis, he brought up an interesting point saying, we all need to do this. And he brought in the concept of bringing it in from multiple data sources, which kind of brings up the question, why didn't you just build this on your Epic EHR? Why did you decide to use SAP HANA instead? And what was the decision-making process that you went through?
Well, actually, we tried. We tried to build our Excelsius dashboards on top of the what Epic has is called Clarity, which is an Oracle structure for us. And the number of records were just too massive to roll it up and present it inside of a dashboard. Now, I know there are ways that you can do things inside of Oracle to aggregate the data to make it available, but the effort involved in those multiple aggregations of the data in order to be able to present it was just an enormous time challenge for us to invest our data architects and being able to do that. But HANA provided the capability for us to dump all the detailed data in there, and we're talking 30, 40 million records or rows of data, and then to roll those up in a aggregate total cost per case, and then be able to quickly drill down into the detail at a surgeon, at a procedure, and even down to the item level, so that we could see what the drivers are. So we actually tried to do this in an Oracle platform before, but we loaded all the data in HANA, and we're able to minimize the time investment from our data architect's perspective and have enough multi-years of data for comparison, and do that all within a few seconds interactively within a dashboard. That's an incredibly powerful approach to analysis when you have the real-time interactivity with the data, so you can approach it with a question, drill around within the detail, answer multitudes of questions without having to submit a request for somebody in IT to fulfill it, wait a few weeks, get that answer back, and then pose another question. What I think is truly unique and different about what we've done here at Mercy, especially in Periop, is the fact the real-time interactivity and explorability of the data platform. That you can see the high-level metric, but then you can go down and try different scenarios, play what if, explore in the detail to actually answer a question. And that's what caregivers really want to do. They want to approach the data with a question. They want to get an answer that will help them do what they do better. And I think that's what's different and what we've been able to do with this platform that allows us to take many sources of data, millions and millions of rows of record, and interact with it and explore it.
And I think what's interesting is, I know that Mercy has an approach of trying to then pass that knowledge on to others. Because even moving from Epic and pushing it out to SAP HANA takes some effort, right? So you guys are working to make that available. Is that right? Or can you talk a little bit more about what you're doing there?
Yeah, that's what's really exciting to me about this whole, what we're doing is that we've been working here inside of Mercy to build these kind of tools for our folks to be able to look and explore the data. But as we've talked about that in forums like this and other healthcare providers have came to us and said, can you do that kind of thing for us? And we actually looked at it and said, you know what, if we just map their data into our same data model, then we can extend through a portal. Other health organizations can have access to the same kind of tools that we do and explore the data, look at it interactively, and drive performance improvement utilizing the data. So we actually do have commercial customers that subscribe to a subscription service that we take their data in on a regular basis, and we extend to them the same kind of tools that we do that we have available for Mercy. So, and that's proved, and we've actually done it, and that's proved to be pretty successful. And it's in its early stages, but we're anxious to work with other providers as they have interest as well.
I think that's great. I mean, it just makes me sick how many times we reinvent the wheel in healthcare over and over when it's like someone has already done this. Why? And I know there's some competitive reasons and commercializing something is a challenge, but I think it's great that you're taking it on. Dr. Delaney, I mean, let's talk about this from a higher level perspective as well. Like it's, I think Curtis addressed many of the changes that are happening in the reimbursement landscape, right? ACOs, value-based reimbursement, where you have to do more with less. I mean, where is all of this going with the reimbursement landscape, and how important will this become?
So, I think it's huge. And in fact, I'd argue that, providing high quality care is kind of, going to become table stakes, but in many ways, the organization's ability to understand and react to, how they're delivering the care and improve and become as a Institute of Medicine terms it as a self-learning enterprise, right? That's able to learn and become smarter based on its delivery of care is really going to become a differentiator in the marketplace and allow organizations which embrace it like Mercy and really begin to have it as a core capability, really be a huge competitive advantage. Analytics as it exists or has existed in the past, based on the disk-based relational databases of the last century, were really things that were backward-looking. How did we do, last quarter, last year, and also were the purview of folks who could write complex queries. And so it was a very select few members of the organization who could get at the data, and the data was always very much lagging the organization, right, by a quarter at least, if not longer. And the challenge is when you're entering in value-based at-risk contracts is that you only have so much cycle time during a contract to figure out how you're doing it course correct. And of course, with the HMOs and all the other managed care last time around, a lot of organizations are very leery of at-risk contracting because a lot of them lost their shirts on it. So the question going forward is how can healthcare organizations become more organic in nature so that they're able to understand actively as it's happening how care is being delivered, where variance is occurring, why it's occurring, and what they can do about it. And beyond that, using predictive to begin to identify challenges before they even occur and avert them, right? So this is the shift of analytics to real time, which I'd say is one large trend. And the other one is democratization of data, so that an increasing swath of decision makers at an organization can engage with data and make a more data-driven, informed decision as they're working and practicing and making administrative decisions across the organization, right? So taking away the kind of intermediaries that had to go and find out the answers from the database and come back weeks later, allowing an individual to sit down with a GUI-based tool, a domain expert, and leverage that tool to look at the data, browse it real time. As Curtis alluded to, the difference with HANA, which is a 21st century designed in-memory computing platform, is we're able to dramatically accelerate that and simplify it, so that we can now allow folks to do this in real time. It's kind of like cubes of the past, with a huge exception, it's off the rails, right? It's free range analytics. You no longer have to look at it along the lines that people assumed was important to you as a user. You can now find a variance and explore it all the way to root cause. And the root cause there, the patient level detail is still in place, because you didn't have to create this rolled up cube in advance to make it look like it's fast. It truly is fast, right? And no matter how you want to look at it, whatever what direction you want to take it, it can get you there and quickly. And what it allows organizations to do is take the same number of data scientists and analysts and really shift their time from a lot of data cleansing and engineering and Excel time to really exploring the data and creating value from it. And that change in organization is fundamental, and it's profound.
Wow. That's a great insight. And I love, how you're empowering both the clinicians, which is what Curtis talked about, and then you talked about empowering the leadership as well, which I think is really powerful. And it doesn't require a data scientist to do it. Dr. Jimmy Vanagan, as we know him, James Legan, he asked the question, can this data also be shared with the patient at the point of care? Are you exploring any possibilities, either one of you, with sharing it with the patient as well, so they can drill into the data?
From my perspective, the only thing that we've really engaged in around that front is around the unique device identifier. So we worked with the FDA on some projects around how do we measure performance of devices and post-market surveillance, and making the information on device performance available through the patient portal, and we call it My Mercy. It's a tool provided by Epic that allows patients to log in and schedule appointments and see details about their health history, and pushing out analytics through that means for things that are important from a patient perspective certainly is something that I can see growing in the near future, especially when it comes to devices and other things like that. But not specifically, other than just thoughts and ideas and a little bit of conversation. That's all that we've seen. But I don't see any reason why certain pieces of information could be extended through those patient portals that way.
Excellent. Yeah, well, I guess that's the next question, right? Is where do you see this going in the future? Is there more you can do in Periop, or are you looking at other areas? What's your approach with this? What are your future plans?
Yeah, there's a lot of things. I think that the door has been opened up for us because of the platform exists that in a way that we can do lots of different things with it. So we continue to work with Periop, and we've been largely focused on what we call descriptive analytics. So what's going on right now? We're starting to tap into the predictive side and what is going to happen if we continue on this particular trend. But where we really want to get to is along the prescriptive side. So we can send alerts, that we can push information out at the point of decision to aid in a better decision, rather than looking at always in the rearview mirror. So I think we're going to see a lot in the prescriptive side in that front. And then beyond Periop, we actually have a lab dashboard that's doing the same kind of results. In fact, we had a number that came in the last couple of weeks, where by avoiding a particular type of test, that one test, eliminating that lab test, was $1 million per year. So there are things like that we're looking at, unnecessary utilization, like a lab test that are not needed. There's another test that does the same thing that has a better result. So we're able to monitor that and eliminate those things. And Lab is doing great things with their dashboard, the same way that we started in Periop. We also have a nursing dashboard that we're looking at labor cost. Nursing labor is one of the biggest drivers of cost in our organization. I think somewhere in the $800 million dollars a year in nursing labor, somewhere in that range. And we're going to be using analytics to look at at the nursing labor cost and what are the drivers behind it, and the use of agency labor and some other incentivized pay, things like that. So we've got our nursing dashboard launched, and it's gaining ground and traction with nursing leadership. So pharmacy is another area, and then our clinic. So we're really focused on these areas that make up the largest percentage of our overall cost picture: nursing, lab, and pharmacy, and periop. And we're going to see some other things, other areas come into focus as we start in these initial service lines. But one other thing that I think is really interesting to mention is the fact that surgeons want in on the act as well. So we're working on a surgeon-centric scorecard that's designed and tailored for their delivery purposes and needs, that shows them not only their cost metrics, but it shows them their quality metrics, it shows them their patient satisfaction survey data, it shows it all in a single portal or in a single dashboard. And that's going to be released, we hope, by the end of this month. We're working with our internal development team to get that out the door. Definitely by the end of March, I think we'll have that out and available. But I think very physician-centric scorecarding is going to be another area that we're going to see a lot of growth in the coming months.
Well, it seems like one of the powerful things is that by using a third-party software like SAP HANA, you build a culture of how to interact with data. So as opposed to building one thing in the, periops in the EHR, the lab stuff's in your LIS, the pharmacy's in your pharmacy system, and you're like, from a management perspective, you're driving yourself crazy. From a user perspective, you have to answer a different question based on which system they're in. But by using this third-party analytics, you build a culture that everyone knows how to use it. And when they call your support desk, it's like, okay, well, I know you're on this platform, so I can give you appropriate support without having to ask you 6 questions to figure out which system you're on and which report, which was built by, oh, wait, that was built by them and that was old. So it sounds like there's a lot of value in that as well. Was that part of your thought process?
Yeah, you're absolutely right, and you highlight a great point, which is a cultural change. I mean, in healthcare for so long, the delivery mechanisms have been centered around an email with a spreadsheet, and changing over to an interactive delivery mechanism that through the SAP HANA and the dashboards and exploration and reporting and interactive and connected to a data platform that's certified and managed, that is a significant culture shift for healthcare. And when you first start engaging and interacting with the clinicians around this new form of delivery, it's a change. And they're so used to just give me the report. But then when you sit down with them and you interactively go through the data and answer their questions on the fly as you go through, and they see the ability to kind of go through that, there's a switch that takes place. And I think that's one of the really interesting things that's happened in Periop, is that we started off a couple years ago and with a dashboard. So the dashboard had these big tiles on it and showed these big metrics on it, and they could click and they could go down. Well, now a couple years later, the most significant aspect or component that's used of the perioperative suite is the Explorer tool. So now they bypass the high-level metrics. They go into the interactive capabilities. They choose their own metrics. They choose their own levels of detail that they want to work with, and the Explorer tool has become a more used tool than the actual dashboarding tool. And that's what's nice about all of these tools run off of the same platform. So what I built for the dashboard and delivering these high-level metrics, the Explorer tool runs off the same data set. And I didn't have to build or create a whole lot a different thing to get the Explorer tool to work on top of it. They're all connected together. And it's the same for reports. So I can have my dashboard, I can have my Explorer view, but then I can connect a Webby report into the same delivery mechanism, because sometimes you do just need a piece of paper that you want to print out and go talk to somebody. So all of those are wrapped into a single delivery mechanism that's working really well for us.
That's brilliant. It's almost like the dashboard was the gateway drug. You got them started, and then you led them to the reporting, the deep dive reporting stuff. That's great.
I don't know if I would use that analogy, but yeah.
Hey, you got to get them involved somehow with the change, right? It's a good change, right?
It's a good change that takes time, and it's amazing to me when you talk to people outside of healthcare. retail or other businesses, they get this, right? And they've gone through, they're more mature in their capabilities around that. And healthcare is evolving rapidly, and it takes some time to get the culture to accept and make the shift. And that's a significant part of this transition that's taking place.
Excellent. I'll add in my partner Shahid. It looks like he's chomping at the bit and wants to say something. But Dr. Delaney, maybe let's finish up the more formal interview segment with, where do you see the platform going? Right. I mean, SAP HANA is great at doing analytics. I learned recently that it can do in-place data capture, so you don't necessarily have to export everything from your EHR or from your other system. It can leave it there and still pull in the data it needs and do the analysis, like you said, real time. I mean, what else is on the agenda for the platform that Curtis and his colleagues will be able to use?
Yeah, I think when you look at HANA and its evolution, it was launched a little over 5 years ago. Started out as a in-memory database, based on 21st century clean sheet redesign. How can we have one single copy of the data stored in a very simple columnar format and run it in a massively multi-parallel fashion, right? So tremendous gains in speed and agility and the ability to simplify everything. Really evolved it over the last 5 years to an in-memory computing platform, because it turns out, and this is somewhat intuitive, that accelerating a query thousands of times is really cool, but often the business value itself doesn't come from the query. It comes from analysis on the data that comes back from the query. So you might run it through geospatial or NLP, or need to do a predictive on it. So really HANA expanded out to a complete in-memory computing platform, where pretty much most activities, whether it's predictive, geospatial, doing further logic on it, calculations, computations, all can be done end-to-end in memory, both faster and far simpler than before. And then over the last several years, we've been focusing specifically on the healthcare sector and really consolidating both, everything from connectors in terms of pulling data in from typical sources within the provider space, to NLP, to ontologies and data models, and packaging that all up in something called Foundation for Health, which really contains all the goodness of HANA combined with the very healthcare-specific extensions that really make it a complete platform that's capable of providing really rapid time to value out there now. And so we're very, very excited to have traction in this, and that was in part beyond just our provider partners and clients such as Mercy, but working with organizations like ASCO, the American Society of Clinical Oncology, on the CancerLink project. You're doing large and complex data sets with a lot of unstructured data, really taking those core competencies and rolling them up into this Foundation for Health. So, it's, for us, it solves a problem that spans all of healthcare, and that's everyone is literally drowning in data, but thirsting for actionable information at the point of decision. So how can we help organizations leverage their assets to make better decisions across the enterprise in real time? And the answer for that is Foundation for Health and HANA.
Interesting. So where can people go to learn more about the work SAP is doing in healthcare? And I assume you're going to be at HIMSS. In fact, I know since I'm going to be there, but give them the details where they can find you.
Yeah, absolutely. We're going to be at HIMSS, have a booth there. We'd love to see you there. We're going to have all sorts of customers, partners, and experts to talk about the technology and help explain how it might be able to help your organization in your journey toward data awareness and impact. Also, SAP website. We have a lot of material and information about HANA, and feel free to reach out. I think my Twitter handle's out there. I'm happy to route you to the right people within SAP. Again, we really are out there working closely and engaging with real customers, and Curtis being a great example. I mean, we absolutely love the work that they're doing there and are very supportive of it, and look forward to a very long relationship where we're able to drive significant value.
That's great. I just checked the notes from before. It looks like SAP's at booth number 5828 at HIMSS. So you can find them at booth 5828. And I'm told, Curtis, you're going to be talking. It looks like the schedule says March 1st, 11 a.m. at the SAP booth. So if you want to get in touch with Curtis, you'll be there. And I'm sure you welcome any of your colleagues and people to stop by and say hi, to talk to you about what you're doing and see how you guys can work together. Possibly even use the work you did rather than having them reinvent the wheel. So yeah, we'll definitely see you at HIMSS. Let's wrap up the formal interview time, and you can see Shahid's just ready to come have a conversation in the after party. So if you're watching live, feel free to hang on and join us for the live discussion in the after party. If you're watching the YouTube version, thanks for joining us. You can find all of our recorded YouTube versions at healthcarescene.com. Also on ehrvideos.com is all of our healthcare IT related video content. So check it out there. I want to thank our guests, Curtis Dudley, Vice President of Performance Solutions at Mercy, and Dr. David Delaney, the Chief Medical Officer of SAP Public Services and Healthcare Industries. Thanks, guys, for joining us.
Thank you, John.